Good. Okay, so we can start with the webinar, and we'll do some brief introductions before covering the topics that we'll go through today, and then starting with our conversation with our guests. I'll start by saying that my name is Fede Menapace, and I work at Beckley Retreats. That is a public benefit corporation, and we offer psilocybin nature-based group programs, and we also offer a therapist practicum. My background over the course of the past 10 years or so has been in psychedelic medicine and psychedelic science. I came to this work because I have a history of PTSD, and I'm a PTSD survivor. And I was very lucky that after moving from Europe here to the US, I was educated and informed about psychedelic medicine. Eventually, I was introduced to a psychedelic practitioner. So I was able to undergo psychedelic therapy, and I was able to really surpass a lot of the issues that were really challenging for me in my life. And so I decided to switch my career. I was pursuing a career in tech at the time so that I could focus on ensuring that these experiences and treatments could become available to as many people as possible. And I then joined MAPS, the Multidisciplinary Association for Psychedelic Studies, that for nearly 40 years has been advocating for the introduction of psychedelic-assisted therapies back into the medical system. And to say that therapist education is a passion of mine, I think would be an understatement. Because at MAPS, we've worked to train thousands of therapists in the US and around the world on learning how to use MDMA as a tool for PTSD. And actually, our uh, panelists today also have this type of background. And so, yeah, Veronica Gold is joining us today. She's the founder of Pioneer Ketamine Clinic, Psychotherapy Clinic here in San Francisco. And she was also part of the MDMA trials with MAPS. And then we also have Kosu Boudreau, and she is a Beckley Retreats facilitator and also a therapist and trained in ketamine-assisted psychotherapy. So I would like to invite you to introduce yourselves briefly, Veronica and Kosu.
Hi, everybody. Thank you so much, Fede, for having me here. So my name is Veronica Gold. I am a licensed marriage and family therapist, licensed in California and Oregon. And I'm a co-founder of Polaris Insight Center, where we provide individual, group, and couple ketamine-assisted psychotherapy, as well as training for therapists. And my background, as Fede mentioned, I worked as a therapist and then also as a supervisor, mentor, supervisor, and educator for MAPS in MDMA-assisted psychotherapy. I'm also trained as a psilocybin facilitator and 5-MeO DMT facilitator for research. And my background is in trauma therapy. So I have a variety of trainings in somatic work, parts work, attachment work, a lot of it connected to trauma, and as well, a lot of alternative therapies that are supporting this work as sound healing, healing in water, aromatherapy, holotropic breath work, and others. So it's been my lifelong passion, and I'm really grateful for the work I'm able to do and share some of it with all of you today.
Thank you, Veronica and Kosu. Do you want to go?
Yes, hi everyone. It's really nice to be here. Nice to be with my fellow practitioners here on the panel. My name's Kosu Boudreau, and I live in Canada. I've been working with Beckley Retreats for the last couple years, along with a private practice that has increasingly focused on integration support. I came into working in the psychedelic field through the lens of spiritual care work. I was a certified spiritual care therapist slash chaplain for more than 25 years before I transitioned into training and working within the psychedelic ecosystem. So I have worked in ketamine clinics and, as I said, have a background also very similar to Veronica in terms of integrative relational approaches that increasingly I'm focusing on psychedelics as a really powerful adjunct for that work.
Okay, thank you so much for the introductions. And so now, right before the webinar, over the past couple of days, we asked participants why they were interested in this, and the key insights is that people want to learn more about retreat-based experiences. I think a lot of the psychedelic care that exists today is more done on a one-on-one basis, and so learning more about retreat-based, that's more than one day. Our programs are, 4 or 5 nights, and then they happen in a group. So how does that work? And we'll talk about that. And then also how to better support clients in understanding the legal environment, what are the training opportunities, how to think about preparation and integration for a psychedelic journey. And then the majority of folks were concerned with things like legal and ethical risks and client safety, and again, training related topics. So we will cover a lot of this ground today, and I would hope that by the end of the webinar, you'll be able to speak confidently with clients about psychedelics, and we will be sharing resources, some of the stuff that we talk about today towards the end, and then also in the emails that are coming after the webinar, and talking a little bit more about options for training, as well as just being like knowing how to refer possibly clients to different experiences in a legal setting. And then we have time for live Q&A. Great. And with that, I'd love to just to ask you both, Veronica and Kosu, why did you decide to become a psychedelic therapist?
Yeah, so I'll go ahead and I would say it's been kind of the past that has unfolded in my life. So when I was 16, I was living in Czechoslovakia. It The communist rule just ended, so I grew up under the communist rule, under the occupation, and right kind of couple of years after the revolution, there was a transpersonal conference in Prague, and so I was just 16 years old, got to the conference, and I met Stanislav Grof, who was a Czech psychiatrist who did a lot of work with research on LSD. He kind of received one of the early shippings of LSD from Sandoz when it was compounded. And he then worked with non-ordinary states of consciousness with LSD psychotherapy in Czechoslovakia and then Maryland Research Institute, and then developed a method of holotropic breathwork. And I was truly inspired by the possibilities of working with these non-ordinary states of consciousness, and that kind of brought me on this direction in my life. I decided to become a psychologist. I decided to move to the United States in 2003, continued my education in becoming a psychotherapist. And because psychedelics were not legal, I was focusing on the treatment of trauma and then worked with clients who were participating in holotropic breathwork, also as an integration therapist for clients who had experiences with psychedelic medicines outside of the United States, or in churches in the United States. And then in 2009, I applied to be a therapist on the MDMA-assisted therapy clinical trials. And it wasn't until 2015, 16 that MAPS contacted me and invited me to be part of the first training for MDMA-assisted therapists. And so that was another kind of a life-changing point for me, where I was able to start doing this work in a legal setting, and connected to colleagues who were already working with ketamine, and then started working at the IV clinic, and then with 4 other therapists on the map study started Polaris. And so it kind of was a lifelong passion, was an interest, was working with clients, and it's really, my clients have inspired me and motivated me for finding new trainings, for finding new ways of supporting them. And so there was a limit with the training that I had, and the tools I had available. And many clients would get better, but then there was still some clients who wouldn't. And I always had a wish that we would be able to work with expanded states of consciousness. And so when I was able to bring that to my practice, it changed my life, my practice, the life of my clients, and Now, most of my practice is with ketamine-assisted psychotherapy and psychedelic integration.
Thanks, Veronica.
It's always wonderful to hear how we end up where we are. There's always a story from it that comes from a very personal basis. You know, when you ask how I ended up being a psychedelic assisted therapist, we'd have to start and first say, well, how did I end up being a therapist at all? And so I'd say my own story really is rooted in my own early developmental trauma. I have a very high ACEs score. So those of you who are familiar with adverse childhood experiences score, I was adopted as a baby and then later returned into foster care and spent a number of years in foster care as a teen. And so there's been a lifelong search for meaning and connection and understanding of belonging and curiosity, I think, that grew out of that around how do we grow into the the strong oak trees that we can be when the ground may not be very fertile at the beginning. And so that led me into spiritual practice. I'm a long time Zen practitioner, which in turn is why I ended up following the path into spiritual care work, working in prisons and then later in hospitals for most of my career. But I was also aware, I think, as many of us who are working in mental health or working supporting communities, that it's really difficult to get at the core of pain that so many of us carry. The root of where the anxiety and the depression and the symptoms of trauma that manifest in so many ways of surviving. And so after a long period spent in hospital and really appreciating and loving that work, I knew that it was time for me to move back into the community, which was really where my roots had started. And I decided to go back and do a social work degree with the intention of working, focusing in addictions. And that in turn led me to the incredible opportunities that are provided in the psychedelic community to be able to address substance use. And I've continued to work in this field. I see that the benefit far exceeds the potential for working only specifically for mental health issues. There's the potential for growth and capacity for all of us in many, many different domains. And so it's really exciting to be working in an area where transformation is really provided as part of the treatment plan, you could say, that it's really body, mind, spirit. It exceeds addressing symptoms and instead going to healing the root and returning us to who we can be. So it's very exciting to be doing this work at this point in my life.
Mm. There you go. So thank you. I like how you also frame psychedelics can be a tool for both healing when people have diagnoses, but also for personal growth if people are well and they're just trying to continue to grow on their path and face some adversities. I'd love to ask, and maybe Veronica, you can talk about the non-psilocybin substances, and then Kosu, you can talk about psilocybin. What are some of the applications, the clinical applications that people can find benefit from psychedelics, and which psychedelics? What does the research show and tell us to date?
Hmm. Yeah, I really resonated with what Kosu was saying right now around really bringing these medicine, helping us to bring us to ourselves, like the path towards wholeness. And so I think that all of these medicines and non-ordinary states of consciousness are allowing this kind of reconnecting with ourselves, processing, letting go of what has happened and transforming it, that it actually can be like a benefit of to who we are. And so in that way, I think all these medicines are helping us to access these expanded states of consciousness. And the research has been showing specific benefits of the different psychedelic medicines that are available. And um, and also the research is kind of, I think there's two parts. That one is really looking from that medical paradigm that's looking at the medicine, at the psychedelic compound as a medication, as it's looking at its neurobiochemical effects. And then we have some of the research, which I think is a smaller part, that's looking at the psychological and transpersonal paradigm, which is looking at the compound being a catalyst for the psychotherapeutic process that's addressing the underlying challenges. Um, and then the transpersonal is kind of a seeing the psychedelic compound as an important access to this expanded state of consciousness. And so I think there are these different researches that we see, and so they have different focus. But so the research with psychedelic assisted therapy with MDMA has been focused on the treatment of PTSD. There has been some phase 2 studies for end of life anxiety, for social anxiety, for couple therapy, for example. And so this is not an extensive list, but we see that MDMA might be really beneficial for all these applications, and we've seen the really amazing results for the possibility of working with clients with PTSD, and um, and so my hope is that it will be rescheduled eventually, and that we'll be able to support clients who are suffering with that. And also then it might be really helpful for couple work, or it might work, have these other applications. Um, Ketamine that is currently available and legal to work in the context of medical care and psychotherapy. There has been thousands, 2 to 3 thousands of studies that mostly have been done in that medical paradigm. And great research results have been shown with clients who suffer with depression, anxiety, trauma, obsessive compulsive disorder, substance use, so that there is really this wide range, with most of the studies focusing on the treatment of depression. And but there is a limit of the studies that have been looking at the psychedelic compound plus psychotherapy, which I think has a promise of even greater results, because we are not only looking at the symptom reduction but also addressing the underlying challenges. And there are other studies that are happening with LSD, um, psilocybin, 5-MeO DMT, and many other compounds that are maybe not as well known, and looking at really addressing the wide challenges in mental health that we are facing. Um, and so there is this excitement that we can find kind of these compounds that might be a fit for a specific person, for the specific challenge they're dealing with, and the setting. So there is a lot of different variables, in route of administration, the time it requires, etc. So the vision is that as we go into the future, that maybe more of these compounds will be available, and that the therapists will have either knowledge or training of working with these different compounds. And maybe if you are a MDMA therapist or ketamine therapist, but see a client like, oh, they might really benefit from psilocybin, to be able to refer them to another provider, and speak with the client, and ultimately, I think clients also are maybe drawn to certain compound, and so that is that part of that inner healing intelligence, inner knowing. And so we want to include that, because the big, I think, shift in this paradigm is that it's the client is the expert. We are not the expert of deciding. We have the information, but ultimately it's kind of collaboration on that.
Yeah, I think this is a good point. And so, Kosu, like if somebody came to you in private practice to inquire about psilocybin, what are some of the ways that you could think about educating the client on what's possible and how to think about doing it safely?
Well, unfortunately, right now, one of the things we have to look at is access in general, and fortunately, there are some places where people do have access to psilocybin, and specifically now. I know we're going to talk a little bit more about the retreat settings in Jamaica and Netherlands in a little bit, and also Oregon, Colorado, and New Mexico now in the US. And we also have some access programs and clinical trials here in Canada. But as I was listening to Veronica talk about the breadth of how these medicines potentially can be used, and also the uniqueness of each of the people that are approaching us and wanting to ask about using them and what they need, it really highlights for me the importance of a very thoughtful and thorough intake process. And so there are many reasons why people may be drawn to wanting to explore with psychedelics now. And there are many different ways of being able to safely and most effectively be able to be supported in that process. So for instance, in ketamine clinics where there's medical oversight, where we would be monitoring blood pressure and there would be very direct one-on-one supervision around a treatment plan, might be really appropriate with somebody with high medical risks, for instance, or who wants really careful supervision. And the people that may be drawn to coming to a retreat setting, like Beckley, for instance, would be potentially, they may also have some medications that they are monitoring that we would want to explore with them. And also, we'd really want to talk about their comfort level around participating in a group setting where there's not a lot of direct medical oversight. But it may be more appropriate for people who want a little bit more sense of space and freedom in the experience. So we highlight a lot of the experience of, being in nature, for instance, and having a little bit more spaciousness in terms of autonomy. There's a careful containment and support, but it's more of a community setting than, for instance, going into a medical clinic. So I would really, I really want to highlight the importance of having a conversation around where the person is coming from, their medical background, their support system, their values and meaning. Taking time in my private practice, I'll usually have a number of sessions with someone
Mhm.
before they make the choice of actually moving into taking any kind of psychedelic medicine, but really wanting to do the preparation and exploring the ground and the basis of where they're hoping to dip into for the deep experience of actually bringing a substance on board that could open them into their deeper states of consciousness.
Yeah, great. And in fact, I wonder if maybe we can put up a slide with the structure of our retreat program because you're touching on a lot of the points, the intake, the preparation. Maybe we could talk a little bit about how in a retreat format we cover that. And then after that, we can watch a short video with testimonials of people that have been on the program. So yeah, cool. So I'll ask you to cover this. If you want, we could also do it together briefly, but maybe I'll just say as an introduction that the retreat program that Beckley Retreats offers is certainly a nature-based immersive experience when you go on the 5 night, 6 day retreat in Jamaica or in the Netherlands, but it doesn't begin and end there. There is a phase a few weeks before where people are coming together in a group, they're talking to facilitators, and then there's an important phase after where we talk about integration. So could you cover a little bit about the preparation and integration aspects as well, please?
Yeah, yeah, absolutely. It is really what makes this program a really sustainable transformational experience. So the preparation is so important. The preparation around the clarity, around why somebody is choosing to make this commitment to do this deep work at this time. And so we have an app with a really extensive 4-week preparation program that gives guidelines around some activities that can be really helpful for self-inquiry, meditation, breath work, movement, reflection, journaling, kind of practices that we hope people will integrate into their life on an ongoing basis that really supports this sense of uh, having clarity around why at this time in your life you're really drawn to doing deep inner exploration. And I would say most of the people who are drawn to coming to retreats usually are at some kind of transitional point in their life where they're really wanting to have a sense of where the next direction is, really wanting to consciously and intentionally align with their values and ensure that they're moving in the direction that feels right for who they want to be in the world. So the preparation is individual. It's also group. There's opportunity to meet others that you're going to be on this journey with. And most of our participants say that the experience of connecting with like-minded community, with people willing to enter into connection with a level of vulnerability and intention, is almost as profound as the psilocybin itself. And that community starts to build long before they ever arrive on site for the retreat. And then the retreat itself is immersive. We help to create a container that really guides people into a deepening process that it's similar to conversation in a sense. When you first meet someone, you start a conversation. You don't generally dive into the deepest, darkest area that you may be wanting to explore, but you need to gently ease in and be able to build trust and soften and create that sense of ease. And so on our retreats, we have an opening circle where there's some joy and connection and sharing. And then we have movement together and meditation practices and breath work. And all of that helps to set the ground for a sense of confidence and ease by the time the participants actually are gathering together to take psilocybin, to take the substance itself. And then a powerful ceremony with live musicians and a very strong presence of compassionate and caring facilitators who come from a wide and diverse background and really hold the space with a lot of love and a lot of safety. And of course, the nature itself, it's the settings. It's really important with psilocybin that we recognize that we are part of something larger than ourselves. That's what emerges as we start to connect with this kind of psychedelic medicine and being really connected in nature and with its vibrancy and presence, as well as others and self, is a very powerful awakening in itself. And so we have 4 to 6 day retreats, depending on the format that you choose. But the integration then that begins on site between each ceremony, we have a day of integration, which again allows for intimacy and sharing, but also time to reflect, time to rest, time to digest. Very important that there's a rhythm here and that we're holding people in a cycle. Psilocybin experiences waves of intensity that softens and deepens and expands just as our life is that. And so the retreat is also built on this beautiful natural rhythm. And then very, very important, and one of the areas as a psychotherapist that I really feel deeply committed to and feel a really strong personal connection with is the integration that we offer following the retreat. This is where people return to their lives, discover what's new, discover where changes may need to be made or deepening of relationships or bringing the change into the world. And so this is the time where support as people are uh, flexible and open in a period of neuroplasticity, which is, part of the magic of psilocybin, but also this really important time of being able to bring the new learning and really be able to embody it and to bring it into a really an action, a sense of aliveness, a sense of realness. This is not just the magic of being on retreat and having the beauty and support and surrounding of all that is optimal, which we all need for nurturance. But then it's carrying that and being able to manifest that out in the world. And I think those of us work in psychedelics, we can get a little zealous and excited because we see the potential for broader change, the collective change that comes out of these individual experiences.
Yeah, and it really resonates with my experience as also a retreat participant that it was so new for me, the experience of being taught skills in the preparation and then when we were on site, and then how integration and group accountability and support with facilitators allowed me to kind of cement these new skills into my life moving forward. And now they've continued to serve me for months, even after. We also have like a very short, I think it's a really beautiful video with some testimonials of people that came on retreat. So we'll play that before we, get ready for the Q&A.
I was drawn to Beckley because it feels like a place that has a lot of integrity. And I was drawn to this work specifically with psilocybin and on retreats because for me it's been one of the most transformative things I've ever experienced in my life.
That sense of reconnecting with the self, everything here within the Beckley retreat is conducive to that.
Creating these spaces to me is not only important and necessary, it's essential to the health of all of humanity.
For those of us who are kind of control freaks, that can be a challenging reality, right? That you're not fully in control of the experience.
I've just made a commitment that I'm no longer going to suppress or numb or deny or ignore the truth of my experience. I'm going to embrace it and feel it and live a more rich and full life. I see the world so differently now. I'm drawn to more of like a peaceful, restful, true vision of a really successful life, which isn't so focused on external wins, and it's more about my like inner state of being, and I just feel so at peace.
I think that the answer for me is definitely kind of starting over. So the way I feel about it now is that I want to consider that my warm-up.
Well, yeah, it's really great to hear the reflection of the people that have been down on retreat and also some of the facilitators. So I will invite people now to think about questions that they would like answered from our panelists. And right before getting into that, I want to show a quick slide of what are some of the resources that we'll touch on, and then we'll share afterwards. And but one of the things that we offer and as Beckley Retreats is also a practicum program where we allow therapists that are in training to come and have an experience to actually sit for some guests that are having a psilocybin experience. And then we're going to be sharing more information about the training program that Veronica and her team ran at Polaris in San Francisco. And then there are a few classes and programs that are offered by several universities, some of the universities we partner with also for our research programs. There are some preparation and integration resources from the Multidisciplinary Association for Psychedelic Studies that can be helpful to both practitioners but also clients. And then we will be introducing a therapist discount program to invite therapists, coaches, and mental health professionals to come down on retreat and try it for themselves, as we believe having an opportunity to have an experience firsthand is just so important, and the ability to then speak to clients about what these experiences can actually carry. All right, so with that said, we're now going to go into a little bit of Q&A. Okay. Bo, you can let us know if you saw anything there. In the meantime, we could start by asking, psychedelics are not necessarily for everybody. What are some of the contraindications for people to come and have these types of experiences? Like, who's best not to have an experience of this type?
Yeah, so there is a variety of medical and psychological contraindications, and so it's important to have a really detailed intake process for the clients to be honest and so some of the and there are specific contraindications that are specific for certain compounds, but kind of the general idea would be from medical perspective. Any, heart, liver, kidney disease could be like an orange flag and needs to be reevaluated before moving forward with these treatments. And then medication contraindication. So different medications are contraindicated with specific compounds and are okay with some other ones. So um, that is kind of part of the medical intake and exploration. And then from the psychological side, some of the contraindications might be history of manic episodes, psychotic disorders, some personality disorders. And so those are all kind of again to bring and to talk about and explore to make sure that this treatment or this exploration is safe for the person who is coming in. Um, and yeah, so these are kind of something that comes to mind.
Yeah, this makes sense. I see a question from Joe from Phoenix asking about psychedelics, how psychedelics can support substance abuse recovery. And I want to speak briefly to some of the information that's coming from research. So there is research, advanced research at NYU looking at psilocybin for alcohol use disorder. There is also research at Johns Hopkins for psilocybin for nicotine cessation, with encouraging results for the AUD study. I think we're in late stage phase 2, and I think phase 3 and will begin soon. And then importantly, there is a kind of um, a very important psychedelic called the ibogaine. It's an alkaloid that came from iboga, a plant from West Africa that is being studied right now to look at benefits for both traumatic brain injury but also opiate use disorder. And it seems to have a lot of promise. So much so that the of all states, the state of Texas just committed $50 million to conduct research on ibogaine for opiate use disorder. That will be awarded if $50 million of matching funds are raised from the outside of the state. And so these are some of the applications. I know, Kosu, you've worked in addiction medicine for quite a while. Can you also speak to how psychedelics can help with recovery?
Well, I'll just say there's a tremendous amount of interest. And I do get a number of clients who are coming and who are looking towards psychedelic treatment to be able to support them in their substance recovery process. Right now, unfortunately, there's limited legal access to ibogaine, but we have a number of high-profile clinics that are in Mexico, and there was just a really beautiful documentary that was just released about that. I think it's called Waves and War or Waves and can't remember, but maybe somebody in the audience maybe will be able to pop that into the chat. And it talked specifically about ibogaine and veterans. I think that in many ways, veterans have been leading the advocacy for addressing for the importance of access to these variety of psychedelic medicines to address very deeply entrenched PTSD as well as substance use and deep existential pain. The suicide rate is painful. So yes, there is a lot of interest. It's wonderful to see the research that is available, and people are in many cases looking for alternative sources, and there are a number of clinics, a number of retreat centers that are offering access to psychedelic medicines that are not fully licensed. And there's a wide spectrum of quality of service and knowledge. And so I will say, just do your research. If it is something that you're pursuing and it's not something that's fully licensed, there, just really make sure that just check out the resource and look at the recommendations and factor that in when you make decisions. Because I know there are many, many people who feel a sense of urgency of having access to psychedelic medicines to treat some really painful, life-threatening conditions. And so there are definitely services out there that are responding to that.
Okay, well, thank you for covering that. We also have a question, I think it's the last one we'll take, around psilocybin and end of life. And I think it's important to mention that the way that psilocybin made it back into the research space, and now there's so much more public awareness and political awareness around the help with psilocybin, is because it was studied for end of life anxiety. And so it was Johns Hopkins University that started these studies around end of life anxiety, and they performed so well that then the FDA, when they looked at the results, they asked, well, we should be looking at how psilocybin can do for depression based on the results in the end of life studies. And so that's how psilocybin research for depression started, and we're now close to FDA approval through some of the drug developers that are bringing them forward. There is also a study at UCSF in California right now, which I think they're going to be enrolling the first patient this Thursday, around end of life anxiety and psilocybin. And so there's a beautiful piece on the New Yorker, I think written in 2014 or 2015 by Michael Pollan, that I could direct people to if they wanted to learn more about that topic. Yeah. Okay, I think we're about to drop, but be on the lookout for an email with a bunch of additional resources. And I'm just so thankful to Veronica and to Kosu for joining today, for bringing all of your knowledge and expertise to the benefit of our attendees. And I hope everybody has a beautiful rest of their day and the week.
Yeah, thank you.
Thank you.